you'll see a lot of the investments that are being made right now come to fruition and start paying dividends, especially things like cancer immunotherapy, which has been an absolute breakthrough in the field.
I think that the need for patients to undergo morbid open biopsies, particularly in patients with brain tumors and other tumors that require significant surgeries for diagnosis, I think that those surgeries are going to be eliminated, and it will be from blood testing that we'll be able to diagnose most tumors.
When we're talking about precision medicine, usually we're talking about finding new genetic alterations that can directly influence therapy.
With how cheap and affordable next generation sequencing is, I think we're going to find what mutations people have, what therapies they might respond to more rapidly, as opposed to how it is now, where everything's not as personalized as it is. It's based on maybe a few genes, whereas in the future we're going to have like the whole readout of someone's genome.
Right now, some cancers, if people have some cancers, they can live with the cancer, they can still live a life like the cancer is a chronic disease. And in the future, I think more and more cancers can be like this.
Everyone would get some prevention reminder card or something that says your gene is more likely to get you some cancer. You need to watch out this diet or this other things.
Maybe there are ways you can boost your immune system, so the immune system will detect cancer for you. And before your tumor even reach a size that can't be eliminated by immune system, the immune cells will find tumor cells and eliminate them as soon as possible.
We'll be able to choose medicines in a certain way, not just to target their disease, but also to reduce the side effects. In pediatric cancer, I think not just about the during therapy side effects, but really the long-term side effects.
A diagnosis of cancer will happen significantly earlier than it happens today. Because as you're being monitored, potentially with apps or with other technologies, you'll have a baseline to draw from that you've had for many years as you're growing older, and any deviation from that baseline will be caught very early before you have the significant effects that might drive you to the clinic in the first place.
I think it's going to be more of an integrative approach. The more we understand about cancer metabolism, the more we can start, and of an individual patient's tumor and its metabolism, the more we can start to make really intelligent and informed suggestions about diet and about, maybe even exercise and lifestyle, and in a scientific kind of way.